we have the pleasure of hearing from Jim Guest, President and Chief Executive Officer of Consumer Reports. To hear that Consumer Reports is one of the top circulation magazines in the US, which is a great achievement over the years. And under his leadership, the organization has launched several new initiatives, including the Consumer Reports Health Rating Center, which develops ratings for services like doctors, hospitals, and drugs. Over to you, Jim.
Timer for 15 minutes, so you don't have to give me the signal. Well, I'm delighted to be here, and for a variety of reasons. But I think what you're working on here is so tremendously important when we look at problems in the healthcare system, and I'll talk about some aspects of it. I'm also pleased to be joining Consumer Reports, to be joining the Bonn University, the Dartmouth Institute, and BMJ. And my folks tell me we've got a room full of superstars here who are already working on this issue and doing some cutting-edge work on it, which is really important. I'll talk a little bit. This conference also is a natural for Consumer Reports because for 77 years we've been dealing with getting evidence-based information about products for the most part, and some degree services, and using that to make judgments and to provide advice to consumers. The overall message I want to give you today, and I'll talk some aspects about it, is to encourage in the work that you're doing, whether you're practitioners, whether you're researchers, whether you're academics or whatever, and I'm sort of echoing a theme that both of you made, that what counts is not having some wonderful papers and discussions and so forth here, it's what's going to actually make a difference in action. And I'm going to really encourage that in all of what you're doing, to look at it from a consumer perspective and think about ways that what you're working on can be communicated, can be framed, can be messaged in ways that consumers can understand and get out to consumers. And so it's a way to have the sort of the public impact that you talked about, Barry, going forward. And I'm also going to urge you to be creative and innovative and somewhat risk-taking or daring or out of your comfort zone and using new ways of communicating and options and possibilities in the digital age. But I want to start with a story because I find one of the things we find at Consumer Reports, well, we're pretty good at, we look at lots of data and things like that, but find that in many cases the most compelling way to reach somebody with a message is not with all the hard convincing data that can tell you shouldn't have this test or this treatment. Is to tell a story and to put it in context. I want to tell you a story about Nick from Durango, Colorado. It's a little bit like this is my analog to the arrow through the head. Nick, in the middle of the night, he'd had some spicy soup the night before, had indigestion, got up to go get the Pepto-Bismol, was walking downstairs to get it, and tripped and cut his head. His wife took a look at him, said, it's going to need more than a couple of Band-Aids or so forth. So they went to the emergency room where Nick needed to get a few stitches to sew up his head. Well, the first thing to do is to say, Nick, we think you may have had a heart attack, so we've got to do an EKG. They do an EKG. Then they go further and say, well, there may be something going on. You may have a concussion, or there may be some kind of a stroke or something that happened there. I mean, you can't just have tripped and fall. There must be some other reason for it. So they do a CAT scan. Then they did a chest x-ray. They never even told them why they did the chest x-ray, but they did the chest x-ray. Finally, they say, well, okay, it looks like you need stitches. We need to get a plastic surgeon. Didn't really need the plastic surgeon. He's waiting for the plastic surgeon. Another doctor walks in and says, you know, I know you're waiting for the plastic surgeon, but we really think there may be a heart issue here. We got to give you a stress test. Well, fortunately, the plastic surgeon arrives first, says, yeah, I can sew you up, sews him up, and takes care of Nick. Well, you know, that's a pretty shocking story. And we have actually, we collect stories at Consumer Reports from people with their experiences in the healthcare system, thousands of stories. Sometime of things you're doing, and you want to look for somebody who, with the data that you've got, can put a story and a face and a voice behind it, let us know at our health rating center, and we can maybe help you. But that's one important thing that we do. You know about Consumer Reports. I won't go into the great deal on it. We've been around for 77 years. You know what we do. We have 4 million subscribers to the magazine, 3.3 million subscribers to the website. You can get us on your iPad, which has 11 minutes left on it. And, oops, no, I just hit starting, and I'm starting at 15 again, sorry. But I won't go through it. You know, we don't take any advertising. We take no money from industry. Actually, we go out and buy every product that we test. We have secret shoppers around the country who go out and buy the product, so the person who's selling it doesn't know it's going to be tested by Consumer Reports. So everything we can do to get the independence of our data. And what gives us the great power, I mean, we have lots of subscribers. We're known, you know, surveys show over 80% of the population knows of Consumer Reports. We're usually rated the most trusted institution in America. So 5 years ago, we've always been doing some stuff in health, but 5 years ago we said, let's really ramp up what we're doing in health. We started the Health Rating Center, Consumer Reports Health Rating Center, with a variety of programs that we're doing now to really try to have an impact on the quality of healthcare, the safety of healthcare in the system. And the Health Rating Center is basically, I mean, we started back in 1936 because the only source of information people had about products was advertising. We said there ought to be some other information that's better. And it's the same with the health center, with the Health Rating Center. It's all this massive advertising that's going on drugs and medical devices, hospitals, doctors, whatever. What the Rating Center is doing is to try to get credible, where we can get credible information and credible data. We'll put out information or recommendations or ratings and everything from hospitals to health insurance plans to preventive tests, drugs, medical devices. Sometimes asking about medical devices, that's a real bug for me. Supplements and so forth, using the same kind of scientific rigor that we do in our other work. And the idea is to try to make an impact as you. I mean, the end goal of all of us is to make an impact for the benefit of consumers, and that's what we're trying to do with the Health Rating Center. Just to give you some flavor of what we do, in the course of this year, this is actually the September issue of Consumer Reports, your Safer Surgery Survival Guide. We actually took Medicare data and used the claims data to estimate adverse events after planned surgery and came up with some interesting and shocking, in some cases, or surprising information about hospitals and what happens there. And it's spurred, I must say at least, it's spurred kind of a national dialogue in some circles about, first of all, why is this information so hidden? There's lots of information you could get about hospitals and their safety records and how they operate. They keep it very close to the vest. We got the Medicare data. We're pushing to get more data around. Going back to what you were talking about earlier, in the, what was the March issue this year, we had an article, here's a cover page article. It got high readership, called Save Your Life, 3 Cancer Tests You Need, plus 8 You Don't. And that got into, well, you know what, from prostate to breast to a whole variety of things. If there are no other indications of any kind, this is certainly one of the areas where there is far more over-testing, over-diagnosis, and over-treatment than is really needed. This was just a couple of months ago in June. We also took a look at Belviq. There's a new Belviq weight loss claim that's out there. We actually looked at this and compared it against a placebo and found didn't make much difference at all, and it did have some health risks. So we came out and said, you know, this is something you shouldn't be doing. It got a lot of publicity. It also got publicity with the investors in the company that make the drug. They threatened to sue us. But we've been sued 16 times since 1936, never lost a lawsuit because we have very careful scientific protocols. We keep all the data. We have our records. Excuse me. By the way, I may have an allergy, and with an allergy, please don't prescribe antibiotics. That's one of the things that Choosing Wisely has said. They don't do any good for allergies, and yet they get prescribed pretty often. The next issue of the magazine, actually coming out in November, we're rating health plans with the National Committee on Quality Assurance. I think we've got over 2,000 health plans, state by state, that we've got here. Again, trying to give people information about the different aspects of it. And another thing we're doing with the health reform, the ACA coming into effect, well, January 1st, but the choice is beginning on October 1st. We're developing a tool to help people, an online tool to help people sort of navigate through making the choice of what health plan to select, state by state by state, using what's there. So those are some of the things that we're engaged in. And then, of course, the big one that you've been hearing about is, I don't have my hot little, oh yes, here's my hot little handout. And by the way, we've got a desk over there, but you were telling me, Lisa, that most of the stuff is already gone, so go over there quickly. Actually, I gave a talk last week at a library, and what the librarian said that Consumer Reports is the periodical most often swiped from the library. So that's kind of a good sign. And I hope things from choosing wisely start getting widely swiped as well from different sources and so forth, kind of when to say whoa to doctors. So we're heavily engaged in that. And one of the things we're doing with choosing wisely is, you've heard about it, and there's more conversation where the American Board of Internal Medicine Foundation is working with specialty societies. Now, over 50 specialty societies have or are in the process of identifying 5 treatments or tests that are most often overused, unneeded, and of course, in many cases, somewhat dangerous. We're taking that information and putting it into plain English and getting it out to the public broadly. And we estimate now, Donald, we estimate we've reached 100 million people with information from Choosing Wisely. So we take all this technical stuff, we put it in a nice, easy to understand form and find avenues to get it out. Tam, I'm sorry, let me know when I got 3 minutes to go. 2 minutes to go. I'm going to stop then. And I had a variety of things. Hey, catch me afterwards, and I'll give you some other messages of things that might be useful to you. But here's the bottom line that I want to leave you with, and to kind of give you a suggestion, a challenge, an opportunity, an offer, whatever the right collection of terms is. I think in all that you're doing, and I know a lot of stuff appears in different in academic journals and in different places, I encourage you to begin to think differently about what you might do with your information. I hope you'll leave this conference are there other ways that I can take this really interesting, important findings that I have and get them out into the world in a way that can really make a difference about the quality of care and cutting down on overtreatment and overdiagnosis and so forth. And I've got a thought. As stories are powerful, and I'm sure some of this feels uncomfortable to people who aren't used to how do I use the media. And it's not just using the media, which is one of the things you talked about, but getting information out directly into the hands of consumers in different fashion. Vogue magazine did an article that had a little tagline on the front page about choosing wisely, and then with all the available tools in the age of social media and so forth, to think about taking what you're doing and finding ways to put into common sense terms that the average person and consumer can understand and get that information out. So what I'm going to suggest, I'm looking for volunteers, and Lisa, you and others can collect the volunteers. We have many of the staff from the Health Rating Center here. John Santa, many of you know, who headed it for a long period of time. Doris Peter, who's running the Health Rating Center now. We're all here, and we've got a table out there. If you'd be interested in working with us and your colleagues on ways to get your information out, to have an impact with your information beyond the normal channels that you have now, would you just come by, give us your information, your contact information. We'll connect you with others here at the conference who want to say, how can we be more, how can we communicate better through different channels to different audiences than what we've done before to get the maximum impact from our work. So let me encourage you to do that, and I'm just thrilled that this conference is happening. And again, the bottom line is now where to go from here to actually have an impact and have action actually happen that helps everyday consumers of healthcare and patients, because that's what you and I are all about. Thank you very much.